Good morning to all of you tuned in. We are bringing you live coverage of the official viewing of the late Dr. Carissa Etienne, Director Emerita of the Pan American Health Organization, PAHO, who will be laid to rest later today. We are broadcasting live via the Government Information Service, DBS Radio, government media sites, social media sites, and we will be with you here until about 12 noon. Dr. Carissa F. Etienne, a globally recognized public health champion and advocate, a daughter of Dominica, passed away in Maryland, USA on December 1st, 2023. She was an illustrious, well-loved daughter of our country, and the government of Dominica has accorded her an official funeral in honor of her outstanding contribution to public health care in Dominica, the region, and globally. Today, Wednesday, January 10, has been declared a day of mourning, and the official viewing right here at the State House Conference Center is set for 9 a.m. to 12 noon. Public viewing will take place at Our Lady of Fatima Catholic Church from 1 o'clock to 1:45 p.m. later today, and the funeral mass takes place from 2 p.m. Interment is at the Roseau Catholic Cemetery. This morning we will see several officials coming through to pay their final respects. However, members of the family will lead the procession. Already in attendance here at the State House is her husband, Mr. Joseph Gregoire, as well as her daughter, Kanika Gregoire. They've already arrived here at the State House, and we expect to see very early, from about 9:10 a.m., Their Excellencies the President and Mr. Burton, the Honorable Prime Minister and Honorable Melissa Scarrett, as well as the Speaker of the House of Assembly. The resident judges are also expected to arrive here about 9:25 to pay their respects to Dr. Etienne, former presidents, members of cabinet, the leader of the opposition, former prime ministers are also expected to make an appearance this morning. Members of the diplomatic corps, members of the House of Assembly, the mayor of Roseau, and the Kalinago chief. We also expect to see the chairman of constitutional commissions, the secretary to the cabinet, who is already here, leading efforts to ensure that all of this goes smoothly. The financial secretary, chief of police, and other senior government officials, heads of departments, will also pay their final respects to Dr. Carissa Etienne here at the State House Conference Center. And importantly, we expect to see a number of the members of the medical fraternity, people who would have worked with Dr. Etienne during her 20-year-long career in Dominica as a medical doctor, medical practitioner, and certainly she held several lead roles within the health sector. Chief among these, or a key role that she held and made a significant impact, was as Director of Primary Health Care in Dominica. At 12 noon, the official viewing here at the State House is expected to come to a close, and her body will be transported to Our Lady of Fatima Catholic Church in Newtown, where public viewing will continue from 1 to 1:45 p.m., following which we will have the Mass. At the official mass, just to note that the main celebrant will be Monsignor William John Lewis and the co-celebrant Monsignor Eustace Thomas. That takes place, as I said, at 2 p.m. And we expect official mourners to include the President and Mr. Burton, the Prime Minister and Mrs. Carrot and other government officials. I'm looking here at the program for the funeral mass, and there's quite a bit of detail about the life and contributions of Dr. Etienne to healthcare in Dominica, in the region, and the world. Dr. Etienne was born in 1952 in the Dutch Caribbean island of Curacao, and she moved to Dominica with her family during her childhood, where she lived in the village of Massac. So she grew up in the village of Massac and likes to refer to herself, or rather liked to refer to herself, as a little girl from Massac, walking barefoot, going to school, being as every child was. She later attended the convent high school in Roseau and graduated at the age of 16. 1 year later, Dr. Etienne entered Mona campus of the University of the West Indies in Jamaica to pursue her childhood dream of becoming a medical doctor. She would later complete her master's degree in community health from the London School of Hygiene and Tropical Medicine in the United Kingdom. She started her career at the Princess Margaret Hospital in Dominica at the very young age of 24, at the time one of only 2 female doctors. And there was some stereotyping at that time, and we're told that she worked very hard to make a name for herself, to overcome that stereotype under the guidance of Dr. Gerald Grell. During her career in Dominica, which spanned over 20 years, she served as Director of Primary Healthcare Services, Disaster Coordinator, and National Epidemiologist in the Ministry of Health. She also served as the Coordinator of the National AIDS Program and Chairman of the National AIDS Committee. Dr. Etienne served 2 separate terms as Chief Medical Officer from 1995 to 1996 and from 2000 to 2002, and she was Associate Professor at the Ross University School of Medicine. And we're looking now as her husband, Mr. Joseph Gregoire, as well as her daughter, Kanika Gregoire, attired in bright yellow. Of course, it must have been a color that her mom loved quite a bit, making their way to the casket to view the body of their loved one. Dr. Etienne would go on after her career in Dominica, doing so much to advance primary health care on island and to strengthen our healthcare systems, to increase universal coverage, and of course that would have put her in good stead, strengthened her reputation as a health practitioner, as a health administrator, so that she could go on to fill these very prestigious and important positions at the regional and international level. She was appointed an assistant director of the Pan American Health Organization, PAHO, from 2003 to 2008, and then as assistant director general for health systems and services at the World Health Organization in Geneva, Switzerland, from 2008 to 2012. She was elected a PAHO director by its member states in September 2012 and began the first of her 2 5-year terms in February 2013. She was re-elected for a second term in September 2017. Under her leadership, PAHO was able to achieve significant milestones for the region of the Americas, none more so than PAHO's response to the unprecedented COVID-19 pandemic. She has been the recipient, or had been the recipient, of many prestigious awards, including the highest award bestowed by her home country, the Dominica Award of Honor, in November 2015, as well as the highest award from Barbados, the Humanitarian Award, granted to her in November 2022. In addition to her many achievements, again at the national level, at the regional level, and certainly on a global scale, Dr. Carissa meant so much more to so many people. She was a devout Catholic Christian who believed in the power of faith and prayer. She and her husband, Mr. Joseph Gregoire, were involved in several church groups, such as the Marriage Encounter, where they would have encountered many couples who I'm sure remember those days and those influences that the two would have had on their lives and their marriages, as well as the Christ in Others retreat core, where they were mom and dad to several young people who again would recall the positive influence they would have had on their lives as young Catholic and as young, well-meaning members of our society. Carissa Etienne, we are told, lived her life as Jesus commanded, loving her neighbors as she loved herself. Her heart was for the marginalized. She would often waive or reduce fees for patients who could not afford it. She was always available for her patients, no matter the time or the demographic. Even while traveling on PAHO business, she took time to visit those who lacked medical attention. She's described as a humble soul who, despite her many accomplishments and accolades, still viewed herself as just that little girl from Massac. She was approachable and welcoming. She greeted everyone with a smile and treated them with respect. She never acted like she was above anyone else. She was a willing listener, we are told, who always gave sound advice without forcing her ideas or beliefs on anyone. She opened her heart and, along with her husband, her home to so many people. And I've seen testimonials, if you will, on Facebook from some, or at least two of the young men who would have been close to her family when she lived in Dominica and who would have benefited from her care and that family atmosphere present at her home and the opportunity to grow and play and develop with her own children in Fortney. So at her house in Fortney, Dominica, it became the neighborhood's basketball ground and library. She became a second mother to many of the young boys who became affectionately known as Carissa's boys. She loved to entertain and hosted many parties. She also had a passion for cooking and prepared a variety of dishes. She loved the holidays, and I've been told that her favorite time of year was Christmas. The food, the drinks, the music, the decoration, gifts, and especially family and friends all brought her immense joy. According to the family, she took her responsibility as a role model very seriously, particularly for the young girls of Dominica who aspire and dream to achieve the same heights as she did. And again, I've seen testimonials on social media of young women attesting to the fact that they looked up to her and her achievement, having ascended to such a prestigious position at the Pan American Health Organization and by extension the World Health Organization. And that example that a small girl, a young girl, a little girl from Massac, or Good Hope, or Benz, or Newtown, Citroën, anywhere in Dominica, could achieve just as much success. So she took that role as a role model for these young women in Dominica very seriously. She was a daughter of the soil, a true daughter of the soil, who loved her homeland Dominica and was proud to represent her country on a regional and global scale. Dr. Etienne is survived by her husband of over 47 years, her 3 children, Kimani, Kwame, and Kanika. We're looking now at images, those of you tuned in via the television station or social media. We're seeing the arrival of the President, Her Excellency Sylvanie Burton, and Mr. Burton. They would just have made a short trek across the courtyard to enter the State House Conference Center, where they will now proceed to view the body of the late Dr. Carissa Etienne, Director Emerita of the Pan American Health Organization. Dr. Etienne passed away on December 1st, 2023 in Maryland, where she lived with her family after completing her term, her second term, as a director of the Pan American Health Organization in January of 2023. Just a recap for those of you just joining us. We're broadcasting live from the State House Conference Center, bringing you live coverage of the viewing of the late Dr. Carissa F. Etienne, who has been accorded an official funeral by the government of Dominica. She will be laid to rest later today following an official funeral at the Our Lady of Fatima Catholic Church in Newtown. She was a globally recognized public health champion and advocate, but more so a daughter of Dominica who excelled to such an extent, to a high extent, an illustrious daughter of the soil who went on to head a regional health organization and did such significant work during her time there. At the national level, we like to say that she was a champion of primary health care, and under her guidance as director of primary health care in Dominica, Dominica achieved universal coverage for all primary care programs. And so it's important to note that even before she excelled at the regional and international levels in the management of healthcare systems, she had already distinguished herself on a grand scale in Dominica. Under her guidance as Director of Primary Healthcare, Dominica achieved universal coverage for all primary care programs with immunization coverage rates of 95%, 90% coverage for prenatal care and deliveries by trained birth attendants, access to continuous care for chronic non-communicable diseases, countrywide community empowerment and participation, as well as health education being integrated into community care. And this is important because it speaks to the core of primary health care, this outreach that allows people to understand the importance of taking care of their health and accessing the facilities and the care that is available at the community level. The Prime Minister, Honorable Roosevelt Scarrett, is about to make his way into the viewing area. He will be accompanied by his wife, Mrs. Melissa Scarrett, the parliamentary representative for the Roseau Central constituency, as well as the Minister for Housing and Urban Development. The Prime Minister will take some time, of course, to greet the husband of the late Dr. Etienne, Mr. Joseph Gregoire. He is accompanied this morning by his daughter, Kanika. Mrs. Melissa Scarrett is also accompanying her husband this morning, and they're making their way to view the body of the late Director Emerita of the Pan American Health Organization, who would have brought such pride to Dominica. And of course, Prime Minister Scarrett would have taken some pride in both her election to the post and her accomplishments during her time spent as PAHO, having supported and rallied for her to fill that position. She was elected by member states, and the Dominican government would have provided support in whatever way was necessary at the time to ensure that she was well viewed upon, that those member states casting their votes viewed her very highly, just as we did in Dominica. And this is not to take away from her personal accomplishments as a successful and accomplished health practitioner, but just to note that the Dominican government would have been very pleased with her accomplishments and her filling of the position of director of the Pan American Health Organization. We read in her eulogy that she was very proud to serve Dominica, She was very proud of what she had accomplished as a young girl from Dominica. She loved her homeland and was proud to represent her country on a regional and global scale. And I'm very sure that many of us are equally proud of her and the fact that she represented us with such distinction. We're seeing making his way to view Dr. Etienne, saying hello to the family, the Speaker of the House of Assembly, Honorable Joseph Isaac. And this is what we'll be looking at for the rest of the morning until 12. We expect that in addition to Honorable Isaac, we will see the resident judges coming through. It is expected to be a steady flow of people here at the State House Conference Center paying their respects. We also expect to see former presidents, so very soon you will see the immediate past president of the Commonwealth of Dominica, Honorable Charles Savary, and Charles Savary, Mr. and Mrs. Savary, members of cabinet. The leader of the opposition is also expected to attend and pay her respects, members of the diplomatic corps and other senior officials, including senior government officials, permanent secretaries and the like, as well as health practitioners, people in medicine, in the medical fraternity, who would have worked with Dr. Etienne in one capacity or the other. Maybe not as a doctor or a nurse, but a ward aide or somebody who would have worked with her at the Princess Margaret Hospital, a pharmacist who would like to come here to pay their respects. That opportunity has been provided this morning to do just that. And we're witnessing now the resident judge, his Lordship Colin Williams, who will pay his respects. The viewing exercise here this morning at the State House Conference Center is scheduled for 3 hours. It will run until 12 noon, after which the body will be transported to Our Lady of Fatima Catholic Church in Newtown for public viewing from 1 o'clock to 1:45 p.m. And the funeral mass takes place at 2 p.m. with interment at the Roseau Catholic Cemetery. I've been advised by the police command here to inform the general public that you should expect delays along Victoria Street between 9 a.m. today until about 5. So about 4:30 or so, you can expect that the procession will make its way from the Newtown Church, Fatima, onto the Roseau Cemetery, and that could get a little bit dicey for traffic. It's par for the course. It's an official funeral, and so the police is advising that members of the public should expect delays throughout the course of the day, because around the midday you will have a procession transporting the body to Fatima for public viewing, and then again at the end of the mass you will have that procession onto the Roseau Catholic Cemetery. So the day might be peppered. At some point in the day you will have a little bit more traffic than usual, or the traffic might be slower than usual, and you should expect that, and we hope understand. Very soon we expect that members of cabinet will begin to make their way here to participate in this exercise, this viewing, official viewing of the late Dr. Carissa Etienne, who passed away on December 1st, 2023 in Maryland, USA. Just about 11 months earlier, she had completed her 2-year period as a director of the Pan American Health Organization. A memorial service was held late last month for Dr. Etienne in the United States, and today she receives an official funeral accorded by the government of Dominica for the role she played as a champion of healthcare in Dominica, and then her role as an advocate for universal care, the leader of efforts during her time at PAHO to achieve universal care for populations in the Americas and the world. Like she was in Dominica, or she was highly regarded in Dominica and by Dominicans, one can expect that she was also very highly respected by the Pan American Health Organization. And I'm going back to the statement issued on December 1, 2023 by PAHO. And before we do that, let's just tell you that you are viewing, those of you tuned in via radio, we're seeing the arrival of former President Charles Savary and Mr. Savary. Again, the process here is we expect that they will stop to offer words of sympathy, words of condolence, of support to the family members who are here, and then proceed to view the body of the late Dr. Carissa Etienne. The family members present are Mr. Joseph Gregoire. They were married for over 47 years, and their daughter, Kanika. Referencing again the statement issued by PAHO on December 1, 2023, informing officially of the passing of Director Emeritus Dr. Carissa F. Etienne, reminding that she would have served PAHO and the World Health Organization as Regional Director for the Americas from February 2013 to January 2023. At PAHO, she is described as a dear friend and colleague, and that under her steadfast leadership and guidance, PAHO achieved significant milestones for the region of the Americas while facing one of the greatest public health challenges with COVID-19. And that's according to a quote from PAHO Director Dr. Jabas Barbosa, who said further, she was very saddened by Dr. Etienne's passing and her thoughts were with the family and friends, and that PAHO cared deeply for Dr. Etienne. The statement would continue that during Dr. Etienne's tenure, PAHO led the response to the unprecedented COVID-19 pandemic in the region of the Americas, as well as efforts to control Zika and chikungunya epidemics and cholera and yellow fever outbreaks in Haiti and Brazil, while significantly improving the organization's response to emergencies and disasters within 48 hours. Under her leadership, the Americas eliminated the endemic transmission of measles, rubella, and congenital rubella syndrome, and made considerable strides in the prevention and control of non-communicable diseases. Of course, we do remember that even in Dominica, when during her visits, she would spend some time talking about non-communicable diseases because she was passionate about it, and also because it is something that we struggle with right here on island. Legislative and regulatory mechanisms gained traction during her tenure as well, as countries enacted legislation on the labeling of food products and introduced taxes on sugar-sweetened beverages. Advances were also made in strengthening national health systems and in progress toward universal health. In the last 5 years of Dr. Etienne's mandate, deliveries by skilled birth attendants increased from 95% to nearly 100%. 100%. And for the first time, the region of the Americas reached the recommended target of 25 physicians and nurses per 10,000 people. Prior to becoming PAHO director from March 2008 to November 2012, Dr. Etienne had served as Assistant Director General for Health Systems and Services at the World Health Organization in Geneva, Switzerland. Before that, she served as Assistant Director of the Pan American Sanitary Bureau from July 2003 to February 2008, where she led 5 technical areas: health systems and services, technology, healthcare and research, health surveillance and disease management, family and community health, and sustainable development and environmental health. During her tenure at both WHO and PAHO, Dr. Etienne directed efforts to renew and strengthen health systems based on primary health care. She has also spearheaded policies for reducing health inequalities, increasing people-centered care, and integrating health into broader public policies. So Dr. Barbosa, the current head of PAHO, said, "We have lost a great public health champion. Dr. Etienne's invaluable experience will be sorely missed in global health discussions to improve the lives of people and to ensure better preparedness for global health emergencies." And just a reminder that Dr. Etienne began her career in her native Dominica as a medical officer at the Princess Margaret Hospital and was later appointed as the Chief Medical Officer of Dominica. She had also served in other high-level posts, including as Director of Primary Healthcare Services, Coordinator of the National AIDS Program, Disaster Coordinator for the Ministry of Health, and Chair of the National Advisory Council for HIV/AIDS. She received her medical degree from the University of the West Indies, Jamaica, and her Master of Science degree in Community Health in Developing Countries from the London School of Hygiene and Tropical Medicine, University of London. So quite a distinguished career in health, and significantly, not only at the local Dominica level, but further afield in the region of the Americas and globally. She would have made her mark as a leader in primary health care, in achieving universal health care for all citizens of these countries. And of course, we thank PAHO for this very comprehensive and glowing tribute to Dr. Etienne, a really good summary of how she would have contributed to health, to improving healthcare and access to healthcare in the region of the Americas. So we're here bringing you live coverage of the official viewing for the late Dr. Carissa Etienne here at the State House Conference Center. We've seen the arrival, and they are seated here with us, of her family members, her husband Joseph Gregoire, her daughter Kanika, and as well as the President and Mr. Burton, who have already arrived here, paid their respects and retreated. The Honorable Prime Minister and Mrs. Carrot, the Speaker of the House of Assembly, former President Charles Savary, and as I mentioned earlier, we expect now to see a continuous flow of members of Cabinet, a leader of the opposition, and the like. Before I leave you and hand over to Kashina Joseph and Stephen Dangleman of DBS Radio, just to remind you of what you can expect today. The viewing here at the State House Conference Center will come to an end about 12 noon, after which the body will be transported to Our Lady of Fatima Catholic Church from 1 p.m. to 1:45 p.m. for public viewing, and the funeral mass takes place from 2 p.m. Interment is at the Roseau Catholic Cemetery. We thank you for tuning in, of course, to share in the celebration of life of Dr. Carissa Etienne, and we invite you to stay tuned throughout the day. Of course, we will be bringing you live coverage on all our platforms. throughout the day, the funeral service from Fatima in Newtown, as well as the burial rites at the Roseau Catholic Cemetery. My name is Dion Durant Smith. I'll be with you again sometime later today. I now hand over to Kashina Joseph of DBS Radio, as well as Stephen Dangleben.
Okay, thank you very much, Dion. Thank you very much, and good morning to all our listeners and viewers on our Facebook page and social media. And of course, we're here, as Dion said, to bring you live the lying in state of Dr. Carissa Etienne. Sunrise, 2nd of November, 1952. Sunset on the 1st of December, 2023. Dr. Carissa Etienne with me to bring live coverage of the lying in state is Kashina Joseph. Kashina, good morning to you. Yes, Kashina, and indeed, it's a very sad day for Dominica. As we, this afternoon, the official funeral for the late Dr. Carissa Etienne, one who has made a significant contribution to health in Dominica, and of course, one cannot emphasize that Dr. Etienne did made an outstanding contribution to health in Dominica, to Dominica over the years.
And not only to Dominica, she was a physician and a healthcare practitioner who was loved all over the world because she worked in various capacities with the World Health Organization and the Pan American Health Organization. So her career indeed took her away from Dominica, but to continue doing the work that she loved, which is building on the healthcare in the region and the world.
And as we speak, we see Honorable Cozier Frederick is interacting with the husband of Dr. Carissa Etienne, Mr. Joseph Gregoire, and also the daughter, that's Kamika, interacting, having a conversation, of course, as the body of Carissa Etienne lie in state. Later on, we'll have the official funeral this afternoon at the Fatima Church, and we expect a number of people to come pay their last respect. Of course, Dr. Carissa Etienne was also a parishioner in the Fatima Church community, and she was also deeply involved in church, Christiana, very much involved. I can recall myself as a young boy growing up in the Newtown area, and Dr. Etienne would have been at church regularly and been very much involved in church activities. She was a reader, she was a commentator, she would be involved in organizing activities for the Fatima Church parish. And not only she was a church goer or church supporter, she was very much involved in church, but she also, Christina, she was also very much involved in her family. She was family oriented. She was very much devoted to her family, and as we speak of family, we see Mr. Gregoire is here along with Kamika, and of course we expect a number of other people to be at this afternoon's, more so a number of parishioners from the Newtown parish to be at this afternoon, or the official funeral for the late Dr. Carissa Etienne.
Definitely, Stephen, and she will be missed by all Dominicans, especially those who she touched in her practice, because even with the positions that she held while she was in Dominica, as Director of Primary Health Care and the other position she held, she still had her private practice. And in our research, because we did a short documentary on her life, we did find people saying that she would often invite people into her office despite even if they could pay or not. She would not turn them away. She would offer them health care and a visit at her office, and that speaks to the person that she is, or she was, that she did it for the love of people, for the love of ensuring that they were healthy, because with a healthy body you are able to then go out and do so much for yourself and for your family. And just yesterday, if I might add, last night, when I was getting ready at my grandmother's house, and I was telling her that I had to go to the state viewing of Dr. Etienne to be here this morning, and she was like, oh, she's getting buried in Dominica, and she told me that she remembers going to Dr. Etienne back in the 80s. So, and my grandmother is actually in her 80s. She's almost 90 years old. So she does remember Dr. Etienne, and that's a lasting impact, that she has made on her patients in Dominica.
And even during the production of the 1 hour we did on Dr. Carissa Etienne, of course, and by the way, we're going to replay that program this morning at 10 on DBS. And of course, we named it Champion of Health, Dr. Carissa Etienne, Champion of Health. And as you said, Kashina, indeed she was a lovely person, a person with a big heart. Even in that program, we heard people speaking of her being an approachable person. She had an approachable personality. She had a charismatic leadership style. We heard of Julie Frampton, who worked with her, said that she had a calm persona. And people like Emmanuel Prince, who was then communications officer in the Ministry of Health, speak to her as, she was very devoted and dedicated to her work. And we heard adjectives like humility, simplicity, highly respected, well loved. And we all know, people who would know Dr. Etienne would know that she was all of that. She was approachable. She was, she had a very calm persona about her. She was simple. She was humble. And she was loved and highly respected by all who knew her.
Yes, Stephen, definitely. And of course, in all of that, she got the job done. She wasn't somebody that had to be forceful in her leadership. Her calm persona spoke volumes, and that brought with it the respect that she desired. A lot of her former colleagues did say that she was not one to be very fussy, but just her personality encouraged them to do the work that was required of them. And especially in the earlier years, in getting Dominica to the point where we became a blueprint for primary health care, not only in the Eastern Caribbean and the OECS, but in the wider region. And of course, she boasted that in her career, of where Dominica came and where we got under her leadership and where we are today.
Yes, Kashina, and one too can remember, many would remember Dr. Etienne as one of the, at the time, she was one of the 2 female doctors at the then Princess Margaret Hospital, and she did play, as a pivotal role in health, because we also heard from the former president, Mr. Eliud T. Williams, and he spoke highly of her while he was the PS in health, and indeed one of the things I think, Kashina, that Dr. Etienne made a remarkable contribution to in the area of health was that of primary health care. She was primary health care director, and we heard from people that we interviewed for that 1 hour documentary how she really got that going in Dominica. And even when she went to PAHO, she would speak of Dominica being taking the lead in primary health care, and she used that that primary health care to to other aspects of her work, even while she was director of PAHO. So indeed, she really made a remarkable contribution to health in Dominica.
And of course, she, upon her passing, she was Director Emeritus of the Pan American Health Organization, and I think that speaks to the work that she did over her tenure as director of the organization. That she didn't just retire out. They gave her that honor, that distinguished title. And of course, there is a representative for PAHO, media representative for PAHO in the room, who is taking photos. I guess that would be shared with the PAN on their website, maybe sometime later today. So for those of you just tuning in, we are here at the State House Conference Center for the Lying in State of the late Dr. Carissa Etienne, Director Emeritus of the Pan American Health Organization. And just walking in, we have the Honorable Fidel Grant, who is speaking with the family, expressing his condolences to her husband and her daughter. He is now being escorted to have his viewing.
Yes, Kushina. And as I said, Honorable Fidel Grant is now paying his last respect to Dr. Carissa Etienne, and is right now just about leaving. I wonder if we could maybe, I'm not sure if we could want to have a quick word with Honorable Grant, but apparently he's about to leave. So maybe what we can do, Christian, is maybe change our location to see if we can speak to a few of the people who are here to view the body of Dr. Etienne. But as you said, Christian, not only did Dr. Etienne served as primary healthcare director, but she was also at one point in time the chief medical officer. She was the chief medical officer. She was also the coordinator of the National HIV/AIDS program. So she wore many caps in the area of health. So she was chief medical officer. She was the coordinator of the National HIV/AIDS program, and also she was national epidemiologist at one time. So she was also the national epidemiologist, and she was also the medical director at the then PMH. So she wore many caps: chief medical officer, coordinator of the National HIV/AIDS program, national epidemiologist, and she was also the medical director. And then she moved on to higher heights at PAHO.
Definitely, she moved on to higher heights, and she was first offered the position of assistant director of the Pan American Health Organization, a position she took up in 2003 until 2008, when she moved to the World Health Organization as assistant director general for health systems and services from 2008 to 2013. And it was then she took up, and she was actually elected by her colleagues to be director of the Pan American Health Organization. And just walking in right now, we see the Minister for Health, the Honorable Cassani Laville, has just walked in, and he is firstly speaking with the family of the late Dr. Carissa Etienne, to her husband Joseph Gregoire and her daughter Kamika, before he is escorted to view the late Dr. Carissa Etienne. And
just arriving as well, we see the Minister for Finance, Honorable Dr. Irvin McIntyre. So he too is going to pay his last respect. He's going to view the body of the late Dr. Carissa Etienne. But as we speak, as you said, Honorable Cassani Laville is interacting with the husband of Dr. Etienne and her daughter, having a conversation. And But as you said, Kushina, yes, Dr. Etienne, we said earlier on, was a very loving person, very caring person. And one thing too about Dr. Etienne, what people can, which is noteworthy, is that she was Dominican to the bone.
Definitely.
She represented her country. We heard during the our 1 hour documentary that from the former president, Elliot T. Williams, saying that one of all the medals that she all the awards that was bestowed on her, that the Dominica Award of Honor, that medal, she would not put it down. She wore that medal to indicate that she loved the country and she was Dominican to the bone.
Definitely Dominican to the bone, as you said. And though her career took her away from Dominica, she often found the time to come back to visit, either in her official capacity as director of PAHO when necessary, but also to visit. And she was, like her cousin told us, looking forward to retiring in her home country of Dominica. And
So as we speak, Honorable Cassandre Laville is paying his last respect to Dr. Etienne, and he's just about to make his exit. Maybe, I don't know if you can have a quick word with Honorable Cassandre Laville. Good morning to you.
Hi, good morning to you. Good morning to the listeners.
And we know, of course, that Dr. Etienne made a remarkable contribution to Dominica over the years.
Absolutely. In Dr. Etienne, we lost a champion. We lost a pillar in health, a pillar in humanity, someone with absolute compassion, someone who, notwithstanding the fact that she rose to the ranks regionally and internationally, someone who has not forgotten her people, who has not forgotten the fundamentals. I remember Dr. Etienne being at the helm of PAHO, and during the height of the COVID pandemic, joining us in our cabinet and sharing information and advice to us, not merely as the head of PAHO, but as a countrywoman, someone from the soil. And that is the type of grounded nature of Dr. Etienne. She has contributed tremendously in this sector. Someone who became director of primary health care. And for many, we hear primary health care, but it is foundational for us in terms of the delivery of care and the way in which we receive care. It's that type of holistic and comprehensive care, the first point of contact for individuals receiving care personally and within communities. And she is the one who formed that structure of delivery of care in the communities. And it is something that was able to be mimicked within the sub-region in the Americas in a capacity as PAHO, because we're able to recognize the many benefits of delivering that type of care, first-hand care. So she has changed things completely in Dominica in terms of the quality and the health outcomes for many. And, she has helped most recently with, laying out the strategy for us to reform the delivery of primary health care in Dominica. We have that strategy detailed, our 2026 plan, and, I fully intend to realize all the objectives and the scope within that. I had the distinct pleasure of being advised by Dr. Etienne. When I became new Minister of Health, I received a call from her, and I will never forget that moment where she gave me sincere and profound advice in terms of expectations of me as a minister. And not only that, I would have been a PAL rep because she's from Marsac. And, I took notes, detailed notes. And I will be using that as my Bible as I serve in my capacity. The world in fact miss a champion, but the impact of her work is profound. I think this is someone sincerely who not only fulfilled her dreams, but someone who realized completely her purpose as a humanitarian, as a person, as a professional. And that extended even beyond that in her life as a mother, as a grandmother, as a wife, and in church and so on. So we'll miss sincerely a hero in the person of Dr. Carissa Etienne.
Thank you very much, Mr. Minister. Thank you very much. that was Honorable Cassandra Laville there, and as we speak, Honorable Dr. Irvin McIntyre is interacting with the members of the family who are here. He's having a conversation with Mr. Joseph Gregoire and Kamika.
Yes, definitely. And Minister Laville revealed something very special, that she left Dominica with one last gift before her passing, which was a plan to aid in restructuring primary healthcare here in Dominica. So that's something that we can look forward to in the future. This last gift from Dr. Carissa Etienne, and Dr. Irvin McIntyre is now being escorted to view the body of the late Dr. Carissa Etienne.
Yes, and as we speak, he's viewing the body of Dr. Etienne. And in fact, Krishna, we have changed our location, so now we're able to speak to the ministers and the other people who will be viewing the body. I wonder if we won't have a quick word with Dr. McIntyre quickly. Good morning to you, Dr. McIntyre. Good morning.
Good morning, Stephen. Good morning.
And of course, we were just remarking that Dr. Etienne is one of the Dominicans, who made a remarkable contribution to health to Dominica.
Oh yes, remarkable contribution. And you can look at it from all angles, in the sense that her contribution towards primary healthcare in Dominica, and just her contribution to the region and the world as well. And what she brought to it was this deep sense of purpose. Someone who was real in what they did. She felt and she understood the plight of the people, and just her whole mannerisms and her whole approach to universal health. And remarkable about her approach was a hands-on approach. She would be there, she would understand what the needs were. She was on the ground, so to speak. She wasn't someone who was running a health system from an office. She would be there with the people, understand what the needs are, and then she would be at the forefront in terms of implementing. So she was one who led from the front, and this is maybe one of the great examples we should take from her as regards to healthcare, leading from the front. We have to be in touch with the people, know what the people's needs, their requirements, their wants are, and then we can address them properly. And that was Dr. Etienne. She was really leading from the front.
Dominica has dealt a major blow with the death of Dr. Etienne.
Yes, it is a major blow, but Stephen, what we have to recognize is what Dr. Etienne stood for and what she did from those days in primary health care. And the only way we can really pay tribute is to continue her legacy as regards to how are we going to take primary health care to the next level, because she understood that primary health care is the foundation of universal health coverage. And she really brought that point across, and we have to continue her legacy by trying to get back primary health care to where it used to be. And actually, the truth about it is we have a choice, we have the opportunity, because actually the remnants of the primary health care system, which Dr. Etienne and Dr. McIntyre and Jennifer Astaf and them put a couple of decades ago, is what actually helped us to be so successful in COVID-19. So we must never forget that. It's not like everything has been lost. No, some of the remnants are there, and we can build on those to make it the primary health care system that we want it to be.
Thank you, Dr.
Thank you very much,
McIntyre.
Dr. McIntyre. We have with us the former president. Quickly, a word quickly. We had you in the program, Dr. Etienne's program. But quickly, we have just viewed the body of Dr. Etienne.
What can I say? Besides, wish she was going to be with us for another several years. I think that was her dream, her hope, to retire in her homeland. And clearly, when I last saw her, she seemed to have had still so much life. But no doubt, the Lord himself had greater plans. So he called her home. May she rest in eternal peace.
Thank you, and that was His Excellency Eliud T. Williams, former president of Dominica.
Yes, Krishna, and of course we're here live at the State House Conference Room, bringing listeners live coverage of the lying in state of Dr. Carissa Etienne, one who has made an outstanding contribution, one who has giving of herself, to Dominica in the area of health, and indeed, and this afternoon there is the official funeral for the late Dr. Etienne. As I said earlier on, that she had a passion for healthcare. She was a motivator. We were heard from people that we spoke to during our 1 hour documentary that she respected her staff, and that's something which really touched me, that Dr. Etienne was one of those who worked with her staff and respected her staff. She wasn't a bully. We were told that she would work with you. If something was not going well, she would approach you in a very nice manner and to get you to understand it wasn't working well. And she respected her staff, and she was a motivator. She was one who encouraged her staff, encouraged people.
Yes.
So she was just a wonderful soul.
Wonderful soul indeed. And the Honorable Darren Pinard, the parliamentary representative for the Collio constituency, is now viewing the body of the late Dr. Carissa Etienne. And we are going to see if we get a short word from him. Hi, Mr. Pinard. Of course, today is a sad day for Dominica, but tell us what you know and what you remember of Dr. Etienne.
Well, Dr. Etienne was obviously someone who made every one of us in Dominica extremely proud of where we came from. As you know, Dr. Etienne represented our country with distinction at the highest level in her field, and she was very proud and always mentioned the fact that she came from this little island in the middle of the Caribbean, Dominica. So she was a proud Dominican and wear that flag with, pride and grace. And she made all of us, she elevated all of us in the process. I got to know Dr. Etienne when I was a boy, still in school, because her son and I went to school together, Kimani. And so once in a while, when there would be something happening up at Fort Meade, then I would, get a little opportunity to sneak in and see what happened if they had a little gathering or something. So I got to know her from an early age. Unfortunately, I didn't get to know her much in terms of a professional capacity, except as an admirer from a distance, So, but her passing was so sudden, and I was looking forward to her term having ended at Power. I was looking forward to her coming back and giving us some more of a services more directly here on the island, but unfortunately that didn't come to pass. They say that the good die young, and so on. So the Lord's will be done, but it's a very sad moment for all of us as Dominicans, and she will definitely be missed.
Indeed, thank you so very much, Mr. Pinard. And we have with us the Minister for Tourism
yes.
and the parliamentary representative for the Soufriere constituency, Dennis Charles Pemberton. Well, you're still a newlywed. We can say congratulations to you on your marriage. But we have an official day of mourning today for the late Dr. Carissa Etienne, and of course, I am sure your paths have crossed over the years. What can you tell us?
It is indeed a sad day. Anytime one loses a loved one, it's not an easy period for the family and the friends, and indeed the entire nation mourns the loss of Dr. Carissa Etienne. She was really a formidable woman. But today I choose to remember her hard work. And I believe that as we mourn her, we should also celebrate a life which gave so much to country and to the world. And I will always remember her outstanding leadership during the time of COVID-19, but especially for Dominicans, she's remembered as a good doctor, a doctor who dedicated her life to strengthening our primary healthcare system and did a fabulous job at it in terms of that and her career at PAHU. So I want to remember Dr. Etienne for being a formidable woman who left a legacy for any woman or all women to emulate, one of service, one of gratitude, one of commitment. And so these are the values I will remember of Dr. Etienne, her stewardship and her commitment to hard work. And she always had a passion for her country. Even if she was the leader of PAHU, anytime the Ministry of Health or the minister or the government will call upon her, she was always available and did her best to advance Dominica healthcare system. And I believe she was looking forward to coming back home to spend her time with being home and doing her gardening, but also to contribute back a bit more to our country and to help us improve on the healthcare system. And unfortunately, she didn't get the opportunity to do so, but the contribution she made to society will never be forgotten, and we'll remember her for that. And we know that she's up there with the Lord, and he will say, work well done, Dr. Carissa Etienne.
Thank you, Minister Charles Pemberton. And of course, we are here at the State House Conference Center for the state viewing
So we can speak to
of the late Dr. Carissa Etienne. We have with us as well the parliamentary representative for the Roseau South constituency, Shakira Lockhart Hippolyte. Good morning to you.
Good morning to you and your listening public.
Today is indeed a sad day for Dominica. Well, it has been about a sad month since her passing on the 1st of December. But I'm sure she was a parishioner in your constituency at the Fatima Church, and I'm pretty sure you have had exchanges with her over the years. What can you tell us about Dr. Carissa Etienne?
Well, as we know, Dr. Etienne was a formidable Dominican woman who contributed immensely to our healthcare. In particular primary health care. And sometimes you find out so much about people when they have passed. I'm pretty young, and I only found out that Dr. Etienne was resident in Fortney only after her passing. Dr. Etienne, yes, she lived out of Dominica and she worked out of Dominica, but she always came back to contribute to our country. And so it's a very sad time for us. We have lost a great woman of the soil, someone who any young person or any young woman would want to emulate. And today I said condolences to the family. There's one who knows my family so very well, and so we send condolences to them, and we as a government, that's a great loss for us, really great loss for us and for Dominicans in general.
Thank you very much, Minister. And we have with us Senator Oscar George, who just came from viewing the late Dr. Carissa Etienne here at the State House. And I'm sure, like most of your colleagues in Cabinet and in the government, you have had exchanges with Dr. Etienne over the years. So what can you tell us about her passing and her loss? What does that mean for us here in Dom?
Well, it's a very sad day for the entire country, and not just Dominica, but also the region. The contribution Dr. Etienne has made to develop in healthcare, in particular primary healthcare, is second to none in the region. And I believe that she has laid the platform for many young practitioners in the healthcare service to follow her footsteps. And I believe she has left a good format for us to follow. So I just want to, on behalf of myself, my family, of course the government of Dominica, express our sincere sympathies to the family. We met the husband and the daughter, very, very strong individuals, and I know that they will be able to pull through. But I also urge everyone to show the support to the family, because many times we lose people. It's a moment of weakness, and that's the time where you need friends and family to support you and provide that strength in this time of loss. But she has made her contribution. Her memory will live on for a very long time in Dominica, and I just urge every young person in Dominica to try to emulate what Dr. Carissa Etienne was able to achieve in her lifetime.
Thank you very much.
Yeah, we also have with us Honorable Julian Defoe, from the P7 constituency. And again, we're speaking with the people who have viewed Dr. Etienne, who have worked with her. I'm sure that you also have interacted with Dr. Etienne for some time.
Mm-hmm. Well, yeah, I would say, and in a very special way. Actually, Dr. Etienne was my doctor when I was a child, as a boy. I used to have certain type of illness, so she took care of me. So this is the memory that I have. Of course, as the years go by and her ascent in her profession and in the regional, international stage. Of course, it had made me proud. I always drawing back on saying, yes, she was my doctor. But I mean, in the general scheme of things, in terms of the state and her contribution, it is well known. And my personality is to celebrate people in life, really not in death. So sometimes you do not see that kind of sudden emotion, displayed from me, because I mostly want to recognize a person for their contributions in life, how they were in life, and how perhaps you were with them in life, rather than death. So she has made a contribution, and which is the state has recognized for this official setting, and of course internationally she is well known. So on behalf of the people from the Pittsburgh constituency, myself and family, I wish again to extend the deepest condolences to the family, and to wish them well and give them the comfort that they know that the entire country is with them and behind them. Thank you.
Thank you for speaking to us then. Yeah, and all the best. Have a nice day. Yes.
Okay, so now coming in, we have the Honorable Darren Lloyd, the parliamentary representative for the St. Joseph constituency. He is now speaking with the husband of the late Dr. Carissa Etienne, Joseph Gregoire, and her daughter Kamika. He is having a conversation with them here before he is escorted to view her body. And of course, we are here at the State House Conference Center for the lying in state of the late Dr. Carissa Faustina Etienne, and the Minister Lloyd is being escorted right now to view the body of the late Dr. Carissa Etienne.
Right, Honorable Kent Edwards, good morning to you. You've just viewed the body of Dr. Carissa Etienne.
Yes, I just viewed the body of Dr. Carissa Etienne. I know her very well, obviously. I worked as a pharmacist in the Lapin Health District for quite a long time, and she always visited us at the Lapin Health Center, because actually at the time she was director of primary health care. She always came to Lapin to visit us, because actually that was where it was piloted, in the Lapin Health District. So she always kept us very close. And as a parliamentarian, I worked at the Ministry of Health, where she was also the director of PAHO by the time I became parliamentarian. And she, as a member, as head of PAHO, she kept in touch with us. She liaised with us. She worked with us, and I remember her very fondly last year when PAHO had their ceremony at the Kempinski and a week of activities, and she was there with us. So Dr. Etienne really is a legend in health, and she's a legend worldwide, as she was obviously in the WHO. She worked at PAHO. She was director of primary health care in Dominica, epidemiologist, and she was also director of primary health care too, and chief medical officer. So Dr. Etienne will be missed. Big legend in Dominica's health.
Thank you very much. We also have with us, good morning to you, Mr. Blackmore. It's a while we have a seat.
Yeah, I'm not sitting in a while, but I'm sitting walking in the morning. So morning. Good morning to our listeners.
I was just saying that people like you would have interacted with Dr. Etienne over the years.
Yes, let me firstly, as I did in Parliament a couple weeks ago, extend on behalf of my family condolences to the family and loved ones and friends of Dr. Etienne. I mean, of course, she originated from the village of Massac. Her mother was a principal. Her mother, Mississippi, we used to call her Mississippi, was a principal of the primary school. And I knew Dr. Etienne, and my sister, Jode Henry, was a nurse. And she worked alongside with Dr. Etienne for many years, driving the primary health care system in Dominica. And I knew her personally also. Her father, Mr. Etienne from Massac, was a distant relative, so she was a distant relative of mine. And she impacted not on the lives of not only people of Dominica, but of course of the world. She made a name for herself and a name for the country, and of course would have inspired many women, to take their rightful place in society and the global space. So I think it's a significant loss for humanity on the whole, and Dominica and the world. And may her soul rest in peace.
Thank you very much, Honorable Blackmore. Yes.
And of course, we have the Honorable Philip Roll, the Deputy Speaker of the House of Assembly. He is now viewing the body of the late Dr. Carissa Etienne. Of course, previously he was having a conversation with her family, and I believe the two other family members are now here. So it is now a party of 4 who are family members who are here.
Okay, so of course we're
joining
here.
their father and sister are Kimani and Kwame, the sons of the late Dr. Carissa Etienne, and they have taken over the spot for the family while their sister and father have a break. So they will be the ones to receive the officials as they come in. Of course, as we wait, we'll go back to Stephen Duncanben, who is outside with the Honorable Philip Roll.
Yes, Kishina, and we're here with Senator Austin Lockhart from the Castlebrooks constituency. Yeah, and of course, Mr. Lockhart, you too, you would have interacted with Dr. Etienne, over the years. Dominic has dealt a major blow with the loss of Dr. Etienne. One was made an outstanding, a remarkable contribution to healthcare in this country and the world.
Yes, certainly, Stephen, and I'd just like to extend my sincere condolences to Dr. Carissa Etienne's husband and her daughter, the family, and in the entire Dominica population, also PAHO, and all the organizations that she has worked with in the past. I mean, Dr. Carissa Etienne is in fact a pioneer, and while I'm part of the younger generation, and we have not directly worked with Dr. Carissa Etienne, she was my grandmother's personal doctor, and for years as a young boy, I would go to Dr. Etienne's office with my grandmother, and the level of care that she provided to her personally, I feel like I have known Dr. Carissa Etienne all my life as well. I know Dominica has really lost, one of the major contributors to the healthcare, and I'm certain that even post her retirement, that should have returned to Dominica and contribute immensely to the healthcare sector on the island. So Dominica has lost an icon, and it's a sad day for us in Dominica, but her legacy will live on.
Thank you very much, Mr. Lockhart. We also have with us Deputy Speaker, Mr. Philip Roll. Yeah, good morning to you, and you too. You have just came from viewing the body of Dr. Carissa Etienne.
Yes, good morning. Good morning to you and all the listeners of DBS. As my colleague, Senator Lockhart mentioned, it is a sad day for Dominica today. There's so much that we can still learn from Dr. Etienne. And, while it is a sad day, I think, you can look on the flip side, and hopefully as we hear about her life and her legacy, we can be inspired by such as Dominicans, knowing that no matter how small our country is or where we come from, we can do great things on an international stage, at an international level. For me, although I had never met Dr. Etienne, I would hear about her quite a bit from my grandmother, because they were very good friends. They used to talk a lot on Facebook about all different types of things, and they would always call each other. So I've heard very good stories from Dr. Etienne from my grandmother, and just listening to her, and listening to the eulogy, the accomplishments of such an individual, it makes me as a young person proud to be a Dominican. So I just want to sympathize with the family. And I think all of Dominica is really sympathizing with the family at this point.
Thank you very much, Mr. Rule. Have a nice day. Okay, DBS here live at the State House. We're bringing you live coverage of the life and state of Dr. Carissa Etienne.
And of course, yes, Stephen, we are here at the State of Conference Center for the line in state of the late Dr. Carissa Etienne. Indeed, a true patriotic Dominican heroine, someone who has worked significantly in the area of health in Dominica. of course, the family continues to receive officials who are expressing their condolences before going on to view the body of the late Dr. Carissa Etienne.
Yes, Krishna, and from the people that we are so far, a number of government ministers and senators also has come in here to pay their last respect. Earlier on, Krishna, you mentioned about this lady who was the photographer here from Pahu, and I tried to ask her if she could speak to us, but she was in tears, and she said she would not be able to because she would have interacted with Dr. Etienne, and for her it's a great loss. And I asked her if she could speak to us, and the minute I said about speaking to us, she broke down. She said she would not be able to. So one can well understand the pain that many people would be going through today, those who interacted with Dr. Etienne.
Yes, of course, we now have representatives from the Pan American Health Organization, PAHO, viewing the body of the late Dr. Carissa Etienne. Of course, I'm sure they would have worked closely to Dr. Etienne. We see them being embraced by their colleague here. Of course, we will see if we can get a word with any one of them. I'm not sure if we are able to, but we are continuing to await the arrival of other officials as we continue with the line in state of the late Dr. Carissa Etienne. Her sons, Kimani and Kwame, are the family representatives right now, and we will have a short word with the representatives from PAHO.
Yes, Krishna, and we're here with, I said, one of the PAHO representatives. Tell us your name, please.
Amalia del Riego. I'm the PAHO representative for the Barbados and the Eastern Caribbean, but I am here also representing the whole PAHO family, and more importantly, Dr. Jarbas Barbosa, our director.
And I can see that you are deeply touched by the passing of Dr. Etienne. Really a sad day for you.
A very sad day for us, for the PAHO family, and for the world, I would say. Everybody that really worked closely with Dr. Etienne knows that in addition to be a leader, a public health leader, and her commitment to public health and to the right of people to have access to health and health care, we also know that she was a fantastic human being.
Lovely person for lovely personality.
Lovely person for lovely personality. Say also, she the time will make sure that people will learn to enjoy life. She will love dancing. She will love, food. She will love culture, and she blended with so many cultures, and that is something that also we carry deep inside.
And she will be greatly missed, even if after she had retired, but she will still be missed by the PAHO family.
She will be missed even after retirement, because as you know, PAHO people never retire really. She was then granted emeritus, and all the director emeritus continue linked to the organization and continue contributing. So of course she will be missed even after her departure. We wanted to have her for many more years.
Okay, thank you for speaking to me then. Let me have a quick word with you as well, and tell me your name.
I'll just say my name, Nicole Slack-Liebert, Country Program Specialist. I'm based here in Dominica.
And again, Dr. Etienne, a blow to Dominica and to PAHO, but most to, let's speak about Dominica, a blow to Dominica.
Definitely so. As Dr. Malia stated, Dr. Etienne will definitely be missed. I've had the opportunity to work with her as well over the years, and it is indeed a deep loss.
Thank you for speaking to me. All the best. Thank you as well. Okay. All right. Of course, we're here live at the State House. Yes, Krishna.
Yes, and we are just about to witness the changing of the guards at the head and the foot of the casket of Dr. Carissa Etienne. I believe they change, I think, every 15 minutes. I'm not 100% sure, but there is a rotation of 4 officers who are standing guard 2 at a time.
Krishna, this is so well done. I really admire when there is a changing of the guards. These police officers do this so meticulously and so, well done.
Yes, definitely. And today is an official day of mourning here in Dominica, as the late Dr. Carissa Etienne will be laid to rest later today. So all flags on public buildings are being flown at half-mast, and of course, for somebody who was not only a Dominican leader and force in the medical profession in Dominica, but internationally, and her career began very early on, because she left school, the convent high school, at just 16 years old, and she took a gap year before going on to UE to pursue her medical degree.
Krishna, she went to UE at a very tender age of 17. So she went to UE at 17, and then right after got into practicing as a doctor following her
at the tender age of 24.
Yeah, for graduation. I think, Krishna, we have now seen the Mayor of Roseau viewing the body of the late Dr. Etienne, and she too would have interacted with Dr. Etienne. The mayor lives in the Kings Hill area, and of course Dr. Etienne is was from the Newtown parish. I'm going to see if I can have a quick word with the mayor. Let me see if I can have a quick word with the mayor. Good morning. Good morning.
How are you? Happy New Year to you.
Thank you. And you have just viewed the body of Dr. Carissa Etienne. I was just telling Krishna, you two would have interacted with Dr. Etienne.
Yes.
You're from the Newtown community.
Yes. I must say she was a very nice person. Sometimes we always say we give people their flowers when they are dead, but I'm getting the opportunity now, and I know Dr. Carissa Etienne was a very nice person, because even when I was working at Astafans, she was our doctor, and she was one who was very motivating. Even when I was working at Astafans, she used to always tell me, and I wish she was here now she had congratulated me as being the mayor, and to continue to, I will always remember her and remember the support. But she was one of the best. So may she rest in peace.
And the Fatima community this afternoon will be in full force at the official funeral.
Yeah, because she didn't forget her church.
Never.
No matter where she goes, she remember her church. So I'm happy that her funeral will be at the Newtown Fatima. Yeah.
Thank you very much. Have a nice day. Yes. Okay.
So while we await other officials who will be coming in to view the body of the late Carissa Etienne, we continue to tell you more about her life here in Dominica and in the wider world. Of course, she retired from PAHO with the distinguished title of Director Emeritus, following quite a long stint from 2013 up until her retirement earlier this year at the head of the Pan American Health Organization. And she would have led PAHO during some interesting and challenging times in the region, through Zika and chikungunya in the Americas, cholera in Haiti, yellow fever in Brazil, during measles in Venezuela, and of course the recent COVID-19 pandemic. She was someone who was at the front, at the helm of healthcare, and basically getting people to be safe during the pandemic, getting word out, encouraging people to be vaccinated, especially Dominicans, to go out and receive vaccines. And I'm sure she facilitated in Dominica being one of the first countries in the region to receive certain vaccines. Of course, I know we received some training from PAHO during that time, as well as aid vaccination. So Dr. Etienne, no matter where she went, she kept Dominica close to her heart and ensuring that our people were healthy.
But I think too that during her tenure as PAHO director, I think that she had some challenging times, you know. I mean, to deal, for example, with the COVID-19 pandemic, chikungunya and Zika and a few of the other, diseases. I think that for Dr. Etienne too, it was maybe a very challenging time, you know. But as we speak, people are continuing to come in here, and as government ministers are coming in to pay their last respect here.
So, as well as health officials and colleagues from the Pan American Health Organization has passed through. Of course, before we came onto the broadcast, while Dion Durant-Smith was on, I believe the Prime Minister Roosevelt Skerrit and Mrs. Skerrit passed through, in addition to former President His Excellency Charles E. Savre and Mrs. Savre passed to pay their respects. Of course, representing the family right now are her sons, Kwame and Kimani. They are here receiving officials, and the cabinet secretary Karen Prevost has just had a few short words with the family members, and she's now viewing the body of the late Dr. Carissa Etienne. Of course, I'm sure she was instrumental in planning this viewing here today. So, Stephen, we'll see if we get a short word with the cabinet secretary.
Okay, Kashina, thanks. And we have with us the Cabinet Secretary, Karen Prevost. Karen, good morning to you.
Good morning, Stephen. And how are you? Happy New Year to you.
Same to you. And it's a very sad day for Dominica today. Later on, we'll have the official funeral for the late Dr. Carissa Etienne. Right now, we have the lying in state at the State House conference room.
Yes, it is a sad day for us. In Dominica, Dr. Etienne was a very positive light to Dominica and to the rest of the world. I'm growing up as my mother being a nurse, as you know. You're a very good friend, Stephen. I've always heard about Dr. Etienne and her impact on primary health care. And it's very sad today that we've lost such a beautiful soul and someone who has made such a positive impact. As a young woman as well, in the senior ranks of the public service, I looked up to Dr. Etienne. She has been quite a mentor, and I really appreciated being able to have someone and to see someone who can aspire and get to that level in the international arena. And of course, her contribution, particularly during COVID-19, will always be remembered by us.
And I'm sure that even as CAPSEC, you also interacted with her.
Yes, of course. We interacted with her from my office, and the official funeral itself is being coordinated by the Cabinet Secretariat, so it is really our pleasure to serve and to do the best that we can to have a great send-off for Dr. Etienne.
Thank you very much, Karen. Yes, okay. So, of course, from those people that who have been here this morning to view the body of the late Dr. Carissa Etienne, we have been hearing so many positive and good remarks about Dr. Etienne. She was a lovely soul, you know. Government ministers and health officials are continuing to come in here to view the body of.
Yes, so we have
Dr.
Dr. Laura Esprit, who has won the cap of Acting Director of Primary Healthcare. So she is one of the physicians here on island who has held a position that Dr. Etienne has held. She has held it during the time of COVID-19. Of course, we would have heard a lot from Dr. Esprit during the COVID-19 pandemic, during the press briefings. She was one of the doctors at the forefront, and I'm pretty sure she's one of the doctors who had the privilege to work closely with Dr. Carissa Etienne, and we will try to see if we get a word from Dr. Esprit. She went in to condone with the husband and daughter of the late Dr. Carissa Etienne. So we will await her exit to see if we can hear from her, because I'm pretty sure Dr. Etienne impacted the life and career of Dr. Esprit. Of course, we are here at the State House Conference Center for the Lion in State of the late Dr. Carissa Faustina Etienne DAH Dominica Award of Honor, a title that was bestowed upon her, I believe, in 2015, if I am not mistaken. Something that she was extremely proud to have received from her country. So, of course, we are seeing other people coming in, other officials coming in to view the body of the late Dr. Etienne and condone with her.
Maybe we can have a quick word with this gentleman. Yeah. So I'm going to try to speak to him. Yes. Good morning to you, sir.
Good morning. How are you doing?
Good. And tell me your name.
My name is Anselm Etienne.
And you are Dr. Etienne's family?
Yes, I am. Brother, last brother.
Last brother. Yes. And I want to extend my deepest condolences to you and to your family.
Thanks very much.
Recently for Dominica, tell me a little bit about Dr. Etienne.
Well, she was a formidable lady. She's very spiritual. She take her work very seriously. Moreover, she see Dominica move forward. That was one of her goals. And she always oversee, but always have Dominica at heart and close to her. But she work well, and the spirit take her out there to do what she have to do, but Dominica was always close to she. But all in all, we'll miss her. We will definitely miss her. And to everybody listen to me, I just want to say thanks for all their condolences and your point of griefs and everything. So it's a life we have to live. We just have to know that God giveth, He taketh. Blessed be His name.
Thank you very much for speaking to me. Have a nice day. Yeah. Okay. Good. Yeah. Of course. Yes, Krishna.
Okay.
As I think people are more government ministers and health officials are coming in to pay their last respect here.
Okay, so we see the arrival of Mr. Emil Lancelot Jr., who will be speaking with the family members here, her sons Kwame and Kimani, before being escorted to view the body of the late Dr. Carissa Etienne here at the State House Conference Center. Of course, this official viewing will be held until 12 noon, Stephen, before the body is transported to Fatima for the mass and burial later this afternoon at the Roseau Catholic Cemetery. Of course, Mr. Lancelot Jr. is having a short word with family members of the late Dr. Carissa Etienne before being escorted on to the next. And of course, the body was in the care of the Linus Funeral Home, of course, who has been keeping the body of the late Dr. Etienne safe and preserved until today. So
earlier on, you were trying to get Dr. Esprit, but she said that she must leave now, so we'll not be able to speak to her. But I'm sure that Ivona, a little later on, will speak with her. I know Ivona will be one of the people on the outside broadcast to bring listeners live coverage of the official funeral. So I'm sure that Ivona will try to have a word with Dr. Esprit a little later on at the official funeral this afternoon. But right now, as I said, we have Mr. Emil Lancelot Jr. just about to view the body of the late Dr. Carissa Faustina Etienne, and many other people, health officials and government ministers and senators are coming in here at the State House to view the body and to pay their last respect to an outstanding Dominican who has made a remarkable contribution to healthcare Christina, in Dominica. One can say that Dr. Etienne would have gone down into the books of the 100 great Dominicans.
Definitely. I believe there is a spot for her on that list of Dominica's 100 great Dominicans, and of course, she always put a country first. We will see if we get a word from Mr. Lancelot Jr. as he exits the State House Conference Center. Stephen?
Yes, Christina. I'm going to try to speak to Mr. Lancelot, and as well as to Barbara Dungo. Good morning.
Good morning. Yeah.
And you've just viewed the body of Dr. Etienne?
Yes.
You would have interacted with Dr. Etienne?
Yes, I had limited interactions with Dr. Etienne in my career, but I've actually had a lot of interaction with my husband, Mr. Gregoire, because I'm from the engineering fraternity that he's from, and he's somebody I had grown to respect highly and learned a lot from in my interactions. And his wife is somebody also that I've respected highly. And so I can conclude, and I think that's the conclusion of every sound-minded individual who would know of Dr. Etienne would know that not only Dominica and the region, but the world has lost somebody great who is of a great stature. She has done a lot. I don't need to reiterate the history behind Dr. Etienne, but we all know that she has contributed immensely to Dominica's healthcare system and the world's healthcare through her working in the international forum. Yeah, so we really mourn the loss of somebody great, a great Dominican and a great international person.
Thank you very much, Mr. Lancelot. Let's see if we can speak to Barbara. Barbara Daly. Yes, Barbara, good morning to you.
Good morning, Stephen.
I'm sure that you as well, you feel very saddened at the loss of a great soul, but one who has made a contribution to healthcare in Dominica, Dr. Carissa Etienne.
No doubt. I was just saying to Kewana, she's family. I was an Etienne before I got
married. That is true because you were an Etienne before. That's right.
So it's life takes an interesting turn on mankind. Almost just about a year ago, we were reading the eulogy for Earl Etienne, and she did that. And that was her cousin, her first cousin. And she had so much fun preparing it because they grew up together. And now, just a year later, somebody has to do hers. But that is what you call a life well lived. Mm-hmm. Sometimes people say when you party a lot and do things, that's a life well lived. When you take care of mankind like she did, and when you are selfless like she was, that is a life well lived.
Barbara, thank you very much. Thank you very much. Yes. So, of course, we continue to bring you live coverage of the Lying in State of Dr. Carissa Etienne here at the conference room of the State House.
Yes, Stephen, and we await other officials and representatives from the Ministry of Health and PAHO, and who will be coming in to condone with the family and view the body of the late Dr. Carissa Etienne, a great Dominican as she has been described. Okay. So we see the entrance of the Permanent Secretary in the Ministry of Health, Letitia Lestrade White. She will be having a word with the sons of the late Dr. Etienne, Kwame and Kimani, before being escorted to view the body of Dr. Etienne. And I'm pretty sure she's also a health practitioner who would have worked closely with Dr. Etienne over the span of her career here in Dominica.
Of noteworthy, Dr. Etienne loved Christmas, and she died on the 1st of December last year. Yes. Because we were told during our documentaries that she really loved Christmas. And
it was a time that she would
Yeah.
have taken, if
Yeah.
I recall correctly, 3 weeks off
Yes.
from work to travel back home to be with her family during that time, to host her colleagues and friends. So we will see if we get a word from the permanent secretary.
So we can have a quick word with
Stephen.
Letitia Lestrade White. Good morning to you. Good morning. I know it's a very, very sad moment for you. And of course, today more so with the official burial of Dr. Etienne.
Yes, it is very, very sad moment for me. A personal friend, it was my personal friend, and also as the permanent secretary of health. When I sought advice from a lot, Dr. Etienne, our conversation was last that she was retiring and she was coming back to Dominica, and her goal was to assist me in taking forward, the primary healthcare services. She had already assigned some consultants to work with us, and it's very hard. It's very hard, And even personally, from family relations, doctor is also my friend. So, but what can we do? I know for me, I will live, by the legacy she left behind and the advice that she has given. I will continue with it. I'm in a different ministry. What is advice that you can, use anywhere you go? So I will continue with that, and I wish the family, my deepest sympathy. I have already conveyed that to them, and that is how it is. Yeah. Okay. Thank you.
Thank you very much, and have a nice day. Yes. Okay. I think we missed speaking to Missy Henderson. She wasn't here.
She was visibly upset. Of
Yeah.
course, that's understandable.
Yeah.
We are seeing.
I think she. In fact, when I tried speaking, I just saw her walked, and she was sad, very sad, and in tears. And one can well understand that today.
Yes.
Mostly, when you come here and you come to view the body of somebody that maybe you had contact with all the time, that you had a nice relationship,
Yeah, so we see the entrance of another permanent secretary, Gloria Joseph, who just had a short word with Kwame and Kimani, and is now viewing the body of the late Dr. Carissa Etienne. We will see if we get word with a PS Joseph, Stephen.
We're going to try to get to see if we can have a quick word with PS Gloria. Good morning to you. How do you do?
I'm doing well, thank you.
And as today's very sad day for Dominica, and you too, I could see that you were very deeply touched.
Yes. Dr. Etienne goes a long way with all of us, Even in my very young days, I would go to her for my medical checks. I think her office was on Cox Street or one of those streets there, so it is a very moving day for us, knowing that this is a woman of significant honor, that has not only touched the lives of Dominicans, but has touched the lives of the region and the world. Not many of us attain to that level. So today is a moving day, and our deepest condolences from my office, our ministry, to her family and relatives and friends. Yes.
Thank you very much. Okay, and yes, Kushina.
Yes, Stephen. So the entrances have slowed down a bit, but we are still seeing officials coming in to pay their respects to the late Dr. Carissa Etienne, Director Emeritus of the Pan American Health Organization and the recipient of the Dominica Award of Honor. And we do not know yet if we will see an entrance from the Director of PAO, Dr. Jabez Barbosa, but in a statement on the day of her passing, he did say, quote, "I am very saddened by her passing, and my thoughts are with her family, friends, and all of us at PAO who cared deeply for her." So end quote. That was part of a statement from the current director of PAO, Dr. Barbosa, who also called Dr. Etienne a dear friend and colleague, who achieved significant milestones in the region of the Americas during what he called challenging times during her tenure at PAHO. So we are hoping that we may see other PAHO representatives come in. I'm not sure if we will see any representatives from CAFA or the World Health Organization, but as we await and we see who is coming in, I'm pretty sure they have expressed their condolences privately to the family, and I'm sure they may have hoped to be here to celebrate the life. Of course, there was a memorial for her in Maryland, the state that she called home away from home. I believe just about 2 weeks ago, and where a number of her colleagues and family members spoke at that memorial service that was arranged, I believe, by the Pan American Health Organization for her up in the United States of America. And today, Dominica, the rest of the world, says its final goodbyes to Dr. Carissa Faustina Etienne. Stephen.
I think it's going to be a changing of the guards, but earlier on I saw Nurse Priscilla Prevost as well as Jean Jacob. Nurse Prevost would have interacted with Dr. Etienne, and also Jean Jacob, who was then the principal nursing officer. They also would have interacted with Dr. Etienne, I think, and they're here as well to pay their last respect to this distinguished Dominican who has made a remarkable contribution to healthcare.
And of course, to them, Dr. Etienne was not only a colleague, but someone who was a friend. Some of them may have as well gone to school with Dr. Etienne and worked with her in fostering the strong primary healthcare system that we have today. Okay, so now we have the deputy police chief. He's actually acting police chief of the Commonwealth of Dominica Police Force.
That's right.
Davidson Valerie, who has been escorted to view the body of the late Dr. Carissa Etienne.
Yes, and I'm going to try to have a word. In fact, he has saluted the body of Dr. Etienne. I'm going to see if I can have a quick word. Let me see if I can have a quick word with Mr. Valerie. Good morning to you, Mr. Valerie. Good morning.
Morning there. Good morning. Good morning.
You have just viewed the body of Dr. Etienne.
Yes. We are paying our last respects to Dr. Etienne, tremendous lady who contributed so much to Dominica and has really brought Dominica forward in terms of healthcare. And so she has done her share, she has contributed. And so God is satisfied that she's done what she has to do. And he has taken her home. A task accomplished.
Mission accomplished.
Mission accomplished. And so, it's really an honor, to see people who have come to the fore and have done so well for the country and for the name of the country. And they're departing with tremendous pride for the people of the country. And so we pray for the family and friends that God would strengthen them and keep them in this time of sadness.
Thank you very much, Mr. Valerie. Okay, acting deputy police chief, and of course, we're here live at the State House, and we're bringing you live coverage of the lying in state of Dr. Carissa Faustina Etienne, born on the 2nd of November 1952, sunrise, 2nd November 1952, and sunset, 1st of December 2023. And a little later on this afternoon, there will be the official funeral for the late Dr. Etienne. As we speak, we see the clerk of the house. He is now coming in to pay his last respect.
Of course, before he views the body, he is having a word with the sons of the late Dr. Etienne, a very short word with Kwame and Kimani before being escorted to do the final viewing of the late Dr. Carissa Etienne. And we expect to see quite a bit more of individuals coming through. And Stephen, will you see if you get a word with the clerk of the House of Assembly?
Yes, I'm going to speak to the clerk of the house who has just viewed the body of Dr. Etienne. Good morning to you.
Good morning.
And you too would have known Dr. Etienne over the years.
Yes, I do. In fact, she is a family member of ours. In fact, my mother said to me that she's some distant relative of ours, and I'm not too sure how close, but she is. And Dominica has really lost a great icon, especially in the field of health. She made Dominica proud. She was one that was fitted for kings and queens, but she still maintained the value, and she could come down to the lowest of us and sit with us and be a commoner with us, and we loved her for that. Her deep faith in God, and saw her through, and she was one that epitomizes what we call Dominica resilience. She really wore Dominica's flag with dignity, with pride, with all what it took. She will be missed.
So we
for
just
caring
had
nature.
one of the
She was
sisters
firm,
of the
but
late Dr.
yet still
Carissa
when she
Etienne
spoke to you, you
coming
could see that
to
motherly
view
figure,
her
that
body
motherly love,
and have a word with her nephews, Kwame and Kimani. Of course, this is not an easy day for family members who will be saying goodbye one last time to their loved one, the late Dr. Carissa Etienne.
in the world, but she was still a Dominican at heart, a Dominican who could still go barefooted. Again, we'll miss her, and we mourn her loss, and let her family be comforted, because the kind deeds will follow her.
Thank you very much. Clerk of the house.
Yes, Stephen. So her sister just walked in to view her body, and she was escorted back into the room where the other family members are located. Her sons, Kwame and Kimani, are representing the family at this time, while the others take a short break from receiving officials publicly. We are, of course, just about an hour away from the end of this official lying-in state of the late Dr. Carissa Faustina Etienne, who did so much for Dominica and the rest of the world with various positions that she held. And it is very interesting and should be interesting to note, Stephen, that Dr. Etienne was at UWI, where she went back to study internal medicine, but then Hurricane David passed and she decided to leave the program to come back home to help in the rebuilding process. And I believe that is what steered her in the direction of what she studied, her master's degree, what she went on to get a master's degree in. Yes. Yes, and she moved from the path of specializing in internal medicine to going on to get a master's in community health in developing countries. So that goes to show that she wanted to aid in the development of Dominica. Of course, we are a small island developing state, and her studies in that field was, I'm pretty sure, to aid in building health in Dominica, but it also went on to assist in building healthcare regionally and internationally with positions she held at PAHO and the World Health Organization. Of course, we see coming in Miss Donnell Blackmore, who is the secretary to the president of the Commonwealth of Dominica. She is having a word with the family members, Kwame and Kimani, before being escorted to view the body of the late Dr. Carissa Etienne.
Yes, well, during the course of the morning, of course, we have with us our program director, Ivona John Baptist Luge, who will be doing live broadcasts this afternoon for the official funeral. But I want to quickly, we have seen a number of officials, government officials coming here this morning to pay their last respect.
Yes. Yes, Stephen, and let me say good morning. And as I say that, we see the Secretary to the President of Dominica, Ms. Donnell Blackmore, paying her last respects. So we have seen quite a lot of officials, government officials and other dignitaries, as Stephen rightly said, paying the last respect here at the line in States, the official viewing. Yes, Stephen?
She worked very closely with my sister, who was in the nursing service when they were spearheading the primary health care. She was a pioneer in that regard. She was a true patriot. She loved her country. She worked hard. She also always looked out for her country and her people. She made a significant contribution, not only public health area, not only in Dominica, but also in the region, internationally. And I think she will be remembered always. And I believe the best way that we honor her memory is by emulating some of the wonderful qualities that she did for service. She was committed. She was dedicated. She was kind. She had a great faith in her family. So that is why the church, I emulated some of those great qualities that she had. It's a great loss for us. I pray that God will give her family and her loved one the comfort, the strength, and the peace to bear that great loss in this difficult time. And I know for sure that Dr. Etienne was received by God. When he saw her, he opened up his arms and said, "Welcome, my daughter. Well done, my good and faithful servant." So that is my consolation. I know that she's in a better place and that she's with her Lord and Savior. And I forever cherish her legacy and her memory. May her soul rest in peace and rise in glory.
Thank you very much. And as we speak, we just seen this Priscilla Prevo and Jean Jacob. You guys, you just came from viewing the body of Dr. Etienne. Yeah, and of course we spoke to you, and you guys are part of the program documentary on Dr. Etienne. Anything else you want to say to us?
She's so much and she served them, served us well. You know,
let's proceed and pray for her. Let's pray.
In addition to viewing the layouts of the body of Dr. Etienne, she was a beautiful person. She looks beautiful, but it was also an opportunity and a privilege to meet with the family, husband and daughter, sons, bless them as they there are many memories, pleasant memories that us and them, and even more them than us, can cherish as we remember the life of Dr.
Thank you very much. Let's proceed and pray for her. I want to have a quick word with Mr. Rupert Sorrento, my former school teacher. Very good, and we have just given you the body of Dr. Carissa Etienne.
Very sad occasion, and remember her as a very accomplished, distinguished, yet very humble Dominican patriot who, in her life here on earth, contributed so much to our own community, various communities around Dominica, through her service in the in the field of health, and to the region as director of PAHO, and in fact to the whole world. And I think we remember the efforts at combating COVID, and we've lost a true patriot, someone whose life here on earth made life better for many other people. So it's a sad day, and what we could say to the family is that she played her part while here on earth, and her legacy will continue to live on.
Thank you very much, Mr. Sorrento. Thank you very much. Okay. Yes, all the best. And yes, Kushina.
Okay, so we have members of the medical fraternity just viewing. We had the Chief Dental Officer, Dr. John, as well as the Communications Officer in the Ministry of Health, Sheena Harry, and Chief Administrative Officer, Senior Administrative Officer in the Ministry of Health, who went on to view. And we also have other employees of the Ministry of Health who have come in to pay their last respects to the late Dr. Carissa Etienne, after, of course, expressing sympathies to her family who are seated. And we are here at the State House Conference Center for the official line in state of the late Dr. Carissa Faustina Etienne.
Trust God that He will see them through.
Thank you very much. Okay, yes. Talk to us quickly too. And Fernanda.
Yes, so thank you.
Your name.
My name is Sheena Harry, Communications Officer, Ministry of Health. Of course, this is a very sad day for all of us at the ministry. We all work so very closely with Dr. Etienne. So seeing her like this and not the vibrant person that we know her to be, or we knew her to be, the person so full of life. So it's heartbreaking for us. And beyond what she's done for health, the person that she was, we remember her as the person, not as the director, not as the pioneer for primary health. No, we know the person.
Vibrant, energetic.
So this is difficult for us. This is not who we know. So we sympathize with her family, and of course all of Dominica, and the health fraternity across the world. We sympathize with everybody because she will surely be missed.
Okay, so we of course had officials from and employees of the Ministry of Health coming in to view and pay their last respects to the late Dr. Carissa Etienne. Of them were Chief Dental Officer Dr. John, Communications Officer in the Ministry of Health Sheena Harry, and a Senior Administrative Officer in the Ministry of Health. And I believe Stephen has one of these people who is waiting to have a word with this Senior Administrative Officer in the Ministry of Health.
Venanda Raymond, you just came from viewing the body of Dr. Etienne.
Yes, I did. Presently, I'm serving as Senior Administrative Officer, Ministry of Health. And as a Dominican, as a woman in Dominica, we know the name Dr. Etienne. And supporting the Ministry of Health, we just want to extend our condolences to her family and to Dominica as well, because she has not only been a pioneer, but an exemplary woman. And we appreciate her service. We appreciated what she did for us as Dominica, but for representing us as a state as well. And that was a super example and a super woman. So we have lost, and we go forward knowing that we have contributed and contributed greatly towards the development of health and the health sector internationally.
Thank you very much, Fernanda. Yes. All right, and more health officials are coming in here to pay their last respects. I think Sheila will be going until 11:15.
Yes, Stephen, we will be on with our viewers until 11:15, and we hope to see a few more officials pass through to pay their respects to the late Carissa Faustina Etienne, Dr. Carissa Faustina Etienne, and to have a short word with her family members who are seated. Of course, we have her children, Kimani, Kwame, and Kameka, as well as her husband, Joseph Kwegwa, who are seated to receive these officials as they come in. And of course, Dr. Etienne, like everybody that we've heard, will definitely be missed, not only in the field of medicine, but as a person who loved life and who loved to have a good time, because of course, like you said, Christmas was her favorite time of year, and she would have been planning such a big get together for family and friends at her home, and of course looking forward to coming back home to Dominica to enjoy her retirement, because I believe she left PAHO just about almost 1 year ago, after giving up the position of director. Her tenure was over as director of the Pan American Health Organization, and she always mentioned that she was a girl from a small island who made it so far in her career internationally, and she is one of the Dominicans who put Dominica on the map internationally. I'm pretty sure there are a lot of people who know more about Dominica because of the late Dr. Carissa Etienne. Stephen.
Yes, Kashina, and I am one of those people. I want to remember Dr. Etienne as one of those who was very energetic, full of life in the Fatima Church community. I can recall, as I said, as a young boy, she should be a commentator, should be a reader. She was very much involved in her church. And we heard from Deria Eugene in the documentary that she's saying how she was very much involved in church activities. And I can recall, and that's how I want to remember Dr. Etienne, one who was full of life, one who was very energetic and very much involved in church, and I don't know, but I think the Fatima Church community is really, really going to miss Dr. Etienne. Even when she was at PAHO, when she came down at certain times, that she would be at Fatima Church celebrating with the parishioners of Fatima.
And we see the entrance of Lady Catherine Daniel, former parliamentarian parliamentary representative for the Collio constituency, paying her last respects to Dr. Etienne, as well as
yes.
And we will see if we get a short word with Lady Catherine Daniel Stephen.
So let me have a quick word with Lady Catherine Daniel. You've just came from viewing the body of Dr. Carissa Faustina Etienne, one that you would have known, very energetic, full of life, Dr. Etienne. Now,
well, you see, sometimes God has his plan for our lives. And you know, Dr. Etienne was very spiritual, as it has been mentioned before. She had the upper chamber prayer group, and I think maybe she has worked well, and God needed her. He said, when your work on earth is past, he'll carry you with him. So I think that's what happened. And she's at peace.
Mission is over on earth.
Mission is over on earth. And I think he has a great mission for her up there, because she was well connected. So she's in eternal peace, but her work continues up there. And I just wish the family strength, because I've known them since I lived in Massac, just next to them. So I've known the family for a very long time. So it's really sad, but again, that's part of living. To live is to die, the Bible tells us. And that's part of living. And what I can say to other people is that we have to make our election right on earth. Be prepared, because we never know the time nor the hour. He said he comes like a thief in the night. So let's be prepared and take a leaf from her example and do what is necessary.
We must be like the scouts. Yes. The motto of the scouts says to be prepared. So we must be prepared at all times, at any time, because we don't know the hour.
We don't know the hour. We don't know the hour.
Something I tell people all the time, we know our birth date, but we do not know the death date.
I remember the first person I really watched die, elderly lady, and she said to me before she died, she said, you know something I've come to realize? That when God gives us, he also places the date of death at the same time. So it's we who have to make it right, and sometimes God gives us the chance. Don't waste it. All have sinned and come short, but when he has given you the chance and the opportunity to serve him, please do that, because and the greatest thing he wants us to do is to love each other, love one another. Don't try to destroy people. You know, help a brother. And if it's that you can do in life, that's your mission. Try to do that so we can live in peace and love, so that when our time comes, he'll say, well done, good and faithful servant.
Amen.
Amen.
Have a nice day. Lady Catherine Daniel.
Of course, we just saw the entrance of former Minister of Health, Dr. Kenneth Daru, and former parliamentary representative for the Petit Savane constituency, a doctor by profession, who I am sure would have crossed paths with Dr. Etienne, both in his career as a medical doctor and in government as the Minister of Health once upon a time. Of course, he had word with the family, and he is now viewing the body of the late Dr. Carissa Etienne, and we will see if we get a short word with him this evening.
Okay, Christina, I'm going to try to speak with Honorable Dr. Kenneth Darrow. You've just came from paying your last respects to Dr. Carissa Faustina Etienne.
Sir, of course, passing away of a great Dominican daughter. I would, of course, have been very close to her. I recall being the Minister of Health when she started her second tenure. It was, of course, uncontested as the PAHO director, of course, and of course would have attended regional council or governing council meetings in Washington. You know, we were presiding over these meetings, and she, of course, being a very jovial and gracious host. You know, after the formal meetings, you know, they always get the opportunity to take me to her office, you know, and we would, of course, talk for hours, sometimes informally, you know, discussing the state of health and, of course, other issues in general.
She was a very bubbly person, full of life and full of energy.
Yes, she was. I mean, it really was a surprise. I mean, it really was a surprise when we heard of her passing. I think this is just, a very grim reminder, that we know not the hour, when. But I think her family and loved ones can live, knowing that she gave it all. I think she represented her country. I mean, with pride, coming from humble beginnings, from her days as a district medical officer, chief medical officer, and of course we all know her legacy will live on, and not just at PAHO, starting right in Dominica. We know she was probably one of the pioneers, in terms of developing the primary healthcare system, which for decades, was really one to be, copied. So I think they can rest assured that she did well. She served the country well, and I think she did the people proud. Yeah, thank you. Yes, thank you.
Thank you very much, Dr. Darrow. All the best. Yes. Okay. Yes.
Yes, Stephen, and we are, of course, here at the State House Conference Center as we continue with the line in state of the late Dr. Carissa Etienne, who will be laid to rest later this afternoon. Of course, the broadcast began at 9 a.m. And we are going on with you as long as we can, as the officials continue to come in to pay their last respects to Dr. Carissa Etienne, someone who has paved the way for a lot of women. Right now, Stephen, I believe there are so many female doctors in Dominica when she came back, she was just one of 2 doctors, and I'm pretty sure that is something that Dr. Etienne was proud of, to see the numbers of women here in Dominica who have gone on to attain a medical degree and come back home to practice medicine here in Dominica. And she can be called a trailblazer in that regard for women in Dominica.
I want to rope in Kiwana Fontaine, Belle Kiwana, because Kiwana has been around for some time. Kiwana, Oti Creole, Sabake, Akifeno, Timwe Plezi, Bonjour, Sakafet, Bonjour.
Bonjour, Stephen.
Sakafet.
Matika SB.
I'm going to take you by surprise. Mais où tu sais depuis le matin avec OK, prévenez-moi que nous devons parler. Tout le monde Good morning to you.
Good morning.
And let listeners your name.
My name is Marlon Murray. I am the United Nations Country Coordination Officer for the Commonwealth of Dominica, and also the godson of Dr. Etienne as well. It's a very close family friend, and just want to say condolences to the family, and Uncle Willie. Dr. Etienne was definitely a very close family friend, actually a mentor. Because of her, I'm actually at the UN right now. She was one of the first persons to know that
she impacted your life.
Most definitely, and that of my family as well. My older brother, Dr. Murray, when he did his residency here, she was the one who supervised him. So, growing up in this family, we were very happy and proud of Dr. Etienne. And now, her legacy lives on, and we will continue her legacy.
She will be greatly missed.
Oh, most definitely, most definitely. The rest of my family couldn't be here, so I'm representing the Murray family. Yeah.
Well, I want to extend my sympathies to your family and to her family, and what I can say is may her soul rest in eternal peace. It's a significant contribution to Dominica in the area of healthcare.
Yeah, most definitely, and especially during the COVID pandemic, that's when I actually came into the UN. We worked very closely to ensure we got vaccines here into Dominica, and the region. We are very proud of her. She did quite a bit of work across the region for us, and we're very proud of the work that she has done.
I was telling one of my colleagues that Dr. Etienne's tenure at PAHO was indeed a challenging time because she dealt with so much. For example, she had to deal with the COVID-19 pandemic, then came the chikungunya and the Zika virus.
Yes, these were very challenging times, and she actually, took them on head on. And at the UN, we are very proud of her and the work that she has done. She has done quite a bit of work within our region. And if we could extend her term, her tenure, I believe she would want to. But she was looking forward to retirement and retiring here in Dominica. But unfortunately, she didn't get that opportunity.
God had other plans.
Yes, most definitely.
All the best and take care. Thank you for speaking to me.
All right, thank you.
Ok, so, yeah, comment tu as parlé là, puis belle qui on avec qui va parler puis encore ou ici depuis le matin avec où pile le monde vient ici avec pour garder cadavre madame
Dr. Carissa Etienne.
Oui.
Moi de cas dit à l'heure Stephen qui il y a pile monde qui a visité. Nous te ka respect qui monde qui visiter, monde qui venir au bas dernier respect yo. Mais moi vraiment étonné pour valer monde qui a venir. Et fait ça qui touche moi aussi Steven c'est les monde garder mon way on peut yo ka play. Puis nous parler ba yo nous tan comment qui a impact Dr. Carissa Etienne a si la vie yo. Et fait c'est pas pour dire ou ka tan yo ka dit ben ouais il était directeur par il était directeur ci directeur ça mais ça qui est tellement simple qui touche yo c'est bité comme prier. Il était une femme qui était prier. Il était une femme qui était prier. Il était un monde famille. Il était un monde famille. Il était un monde qui était gentil. Il était aimé. Oui. Malgré monde qui était sérieux quand travailler, il était sérieux quand ça était faire, mais il était en l'autre côté, il était vraiment gentil. Il était un monde qui monde aimé. Il y avait monde qui changeait pour ça. Qualité impact ça a été ni assez.
Oui, Christian was saying?
Saying that we are seeing the entrance of some family members of the late Dr. Etienne, speaking to her immediate family here, and we saw some really strong embraces as they came in and they will be going on to view her body, of course, after speaking with them.
Oui, on a constaté que ma famille, Dr. Etienne, après ça, il est venu pour garder cadavre, Dr. Etienne.
Eh bien, il touche moi un peu, puis moi j'ai changé l'année passée, moi j'étais jeune puis enfants, filles, puis filles aller l'école puis moi l'école secondaire.
C'est Kamika.
Puis avait les mots tant ça moi premier monde m'a changé c'est. Puis c'était capable puis moi encore tout ça c'est plan qui m'a été ni après il retraite hot power pour vivre Dominique avec tout ça comme ça. Quand aujourd'hui moi pas boire assez grand puis moi la peine puis il y avait les autres ces familles foi il y avait aussi papa mais certains il perdit en maman qui la terre connaître il perdit en maman qui en pile monde te connaître pour manière il toucher la vie à une manière hard qui sentit il était un docteur il y avait monde qui a changé les yoté aléoti il était un docteur qui était gentil Steven ici un docteur qui a touché c'est pas ni aléoti docteur le docteur de Misa à l'époque ça mais il était touché physiquement il était touché dans cette manière comme ça un monde comme ça nous qui continuer chez lui même moi avec nous qui prier qui famille qui ni soulagement avec pour les autres nous comme dominicains pour nous ça ouais comment nous ça par exemple hors la vie Dr. Carissa Etienne puis c'était une bonne qualité qui nous ça par exemple assis
quand on dit pas seulement qui était un monde grand officier par mais la vie là qui vivent à Dominique avec contribution qui fait pour Dominique avec nous quand qui comme si il y a pas au chez Dominique
Dominique était à vivre mon temps il tenait plan aussi pour continuer travail et assister ces monde là qui a primary healthcare puis même si vous retraite Steven ou quoi il y a autant bité d'autres où ça fait d'autres contributions ça fait puis on y la vie et on y en richesse on y en don on y en ça l'esprit qui les autres monde ça bénéficie comme ça il était vraiment bon bitin après tes retraites pour ça retourner et continuer à assister pays dans sa santé.
Yes, indeed. Ivona, yes. Kashina, we have. So maybe I can have a quick word with her. We see somebody who was just paying their last respect. I'm not sure who is that individual, but maybe we can have a quick word, and she will tell us, her relations with Dr. Etienne. Let me see if I can have a quick word with her. Yes. Okay, let me see if I can have a quick word with her. Good morning to you. Good morning. And tell me, can you just tell me your name?
Margaret Trudette Baptist. I'm from the Ministry of Health, Wellness and Social Services with responsibility for social services.
Those who have interacted with Dr. Etienne.
No, I recently joined the ministry, so I know her because I worked previously at the Ministry of Foreign Affairs, so I know her from that perspective. But her involvement in the Ministry of Health would have been before my time because I recently joined. But from all I know, she is a fundamental, phenomenal person. She did very well for Dominica, having been at the highest level internationally. She did put Dominica on the map, and I'm very proud of her achievements. It's a great loss to the Commonwealth of Dominica, and just here to pay my last respect, to her. So from the Ministry of Health, Wellness and Social Services, I do extend my deepest sympathy to her family on the passing.
Thank you for speaking to me. Yeah, have a lovely day. All right then, okay. So of course we're here, and by my watch 11:26, and people, health officials, government officials are still coming in to pay their last respect here to Dr. Carissa Faustina Etienne. There's a lull right now, Ivona and Kewana and Kushina.
Yes, definitely. Yeah. But of course, quite a number of people have passed through to pay their last respects to the late Dr. Carissa Etienne, and of course have word with her family members who are here. Of course, her husband, Joseph Gregoire, and their 3 children, daughter Kamika and sons Kwame and Kimani. And they are, of course, whenever we have these official funerals and state viewings, the family members are always very strong. They put on quite, because they have to deal with sitting with their late loved one as people come in. And of course, we ourselves here at DBS Radio express condolences to the family and the friends of the late Dr. Carissa Etienne on her very sudden passing. We, of course, all of Dominica, we were looking forward to Dr. Etienne, of course, coming back home to retire, to enjoy not having to travel as much and to work as hard as she was. But it was something that her cousin who spoke with us last week stuck, and he said some people, God put them on this earth to do something, and he takes them away as soon as they are finished with that task that God gave them on earth. And he, of course, was one of the only family members who was able to speak with us for her program. And he said he will forever cherish the last night that he saw her, which was actually the day before she passed. That will forever be in his memory, just sitting and speaking with her and her husband at their home up in the United States.
Yes, and of course there was Ackroy, Birmingham, you're referring to. Kashina and Ackroy. I think Ackroy was a cousin of Dr. Etienne, and he mentioned the fact that Dr. Etienne loved Christmas, loved life, loved all of our Christmas goodies, and it is just sad that Dr. Etienne died just around Christmas time, 1st of December. Didn't get to enjoy the last Christmas. But as we say, God had other plans, and she, as we have been hearing, that it was her intention to come back here to retire and to continue to make her contribution to healthcare in Dominica. But again, God had other plans.
Yes, Stephen, and as we ourselves wind down here on our broadcast, we want to thank everybody for tuning in. Of course, we are live on social media for here at the State House for the state and official line in state of the late Dr. Carissa Etienne, who passed, like we said, on November 1st, 2020, on December 1st, 2023. at her home in the United States, her second home away from Dominica, her first home. Of course, someone who did so much, not only for Dominica. She was Dominican, but we allowed the rest of the world to claim her as well, with the good work that she did internationally, not only locally and regionally. Of course, we will be seeing some more people coming in, hopefully. Like you said, there is a lull. Well, quite a bit of people have passed through from the,
a couple of health officials, couple of government officials, government ministers have come in here already this morning to pay their last respects to Dr. Carissa Etienne, and the majority of people that we spoke to this morning, Kushina, they lamented the fact that Dr. Etienne made a significant, remarkable contribution to healthcare, and the word primary healthcare keeps coming up all the time. That that was her baby. That was something that she really started. And she made a significant contribution in that area of primary healthcare.
And I believe she did that in Dominica, but at PAHO as well, she did some good work, and she made one of the things that stands out throughout her tenure at PAHO is the fact that she significantly improved PAHO's response to emergencies and disasters, in that there was response from the organization in just about 48 hours. So within 48 hours of a disaster occurring in one of the region in any of the regions where PAHO is represented, there were PAHO representatives with boots on the ground. And of course, we saw that after the passage of Hurricane Maria, Dr. Etienne and her team were here in quick time on island, addressing the people of Dominica during a state press briefing. Of course, she was somebody who left Dominica as the Minister of Health, Honorable Cassani Laville, revealed to us this morning that she left Dominica with one final gift, a strategic plan for revamping primary health care in Dominica, something that he said he promises to put into action and put into place, of course, in her honor and in her memory.
As we speak, there is again changing of the guards. So we see two officers going to be replaced. They're going to be replaced by two other officers. Changing of the guards here. There's the line and state of the late Dr. Carissa Etienne.
So, Stephen, I believe this is it for us here as we are winding down. Of course, viewers can continue to view with sights and sounds, but that's we have come to the end of our task here today at the State House Conference Center for the official line-in state of the late Dr. Carissa Etienne. So our viewers are more than welcome to stay tuned to our social media until the end of the official line-in state, which ends at noon. But for us here, Stephen Dangoben, I'm pretty sure our viewers were happy to hear you on a broadcast in such a long time. How long has it been, Stephen?
No, it was really my pleasure, and maybe to Kushina, I personally knew Dr. Etienne, so I had to come in here to make my contribution and to pay my last respects as well to one who has made a significant contribution, outstanding, a remarkable contribution to Dominica and to Dominica's healthcare system. And so it was a pleasure working with you here this morning at the State House and the line and state of Dr. Etienne. And I want to join in to wish, to extend my deepest condolences to the family of Dr. Etienne and to Dominica and the world all over, those for her contribution to healthcare. And I want to wish everybody well, and I want to say, may her soul rest in eternal peace.
Yes, Stephen. So our listeners, our viewers, you can continue viewing and with Sights and Sounds. As we end today, it was my pleasure as well working with you, Stephen D. I hope this is not the end and we will hear more from you on the airwaves pretty soon. So on behalf of my colleague Stephen Dangaben, I'm Krishna Joseph. We are leaving you with Here Today.